Hi.
Hi. Hi.
I'm Julie Tyler.
I'm Julie Tyler.
And this
is Colonics TV.
As you talk about inside-out beauty,
3 or 4 days they can make a big turn.
It is all about adaptability.
Join us each episode
as we examine a sacred and holistic therapy
dating back to the ancient
Egyptians.
Together we will meet countless individuals who are exploring colon hydrotherapy for themselves.
That's one area that colonics really could have such impact.
God, yes.
And seeing firsthand how this therapy, when added to a health regimen,
can help minimize a broad range of symptoms and even help reverse a number of common illnesses. Find out what your doctor simply doesn't know and therefore isn't telling you, and why the outdated and misguided arguments against colonics
don't hold water. Tune into Colonics TV.
Colonics TV. Tune into Colonics TV if you're ready to maximize your health
from the inside out and
from the bottom up.
So I'm Ashley Koff. I'm a registered dietitian.
I'm Brenda Watson, and I became passionate and very involved in colon hydrotherapy because of my own health challenges.
I'm known as the health detective.
Jennifer Knott, and I'm an integrative nutritionist and longevity coach.
I'm Donna Gates with Body Ecology, and I've created a system of health and healing that tens of thousands of people around the world live by today.
As a traditional naturopath and as a holistic rejuvenist and a homeopath, what we are trained to do is deal with lifestyle changes, detoxification.
I have been doing colon therapy myself for about 30 years and recommending it to many, many people.
I took care of a lot of people with colon cancer and with diverticulosis, diverticulitis, and polyps and all kinds of afflictions of the colon.
You know, the subject of colon therapy is complex and fascinating.
I think of it very similar to the same way that I often will refer people to an acupuncturist. You know, an acupuncturist helps the body's systems talk to each other again. It's a communication tool. And that's really what colon hydrotherapy can do.
The truth is, colon hydrotherapy is a very safe modality.
I had already been using colon hydrotherapy for years, sending my patients there when they had any kind of immune system disorder, any kind of toxic burden. In other words, migraines, arthritis, fibromyalgia, whatever.
After years and years of being constipated and not even knowing the definition of it,
the first thing I ask them about is their elimination.
Unfortunately, talking about poop.
I would actually ask them, you have a bowel movement every day? They say, oh yeah, oh good. Twice a day, once a day? Maybe it'd be once or twice, and it's okay, well, now we're going to do the length test.
And I get graphic. You know, I want to know, is it pellets? Is it regular? Or does it smell? Does it float?
People get uncomfortable when you talk about it, but I mean, it's something as important as breathing.
And we talk about over the course of a month, especially with women, how does it change? With men, we might talk about when you're traveling.
Enemas have been out there for a long time. So it makes perfect sense that a controlled enema would be the next step.
And sometimes people need to go for a couple very frequently in the beginning, or sometimes people go once a month for a couple of months. It kind of depends on what we're working on with the patient.
I now think people ought to do it not only therapeutically but diagnostically. And we now know that chronic low-grade inflammation is really the cause of almost all of the disturbances that we deal with on a physical and emotional and mental level.
We've all heard of foods that can cause inflammation, and any doctor will agree that inflammation is the pathway to disease.
There are about 40 different autoimmune conditions today, and they kill people, by the way, including cardiovascular disease. It begins as an autoimmune condition, and it begins in the gut.
Well, I think all the autoimmune diseases on some level are connected to the intestinal tract. If you've got the wrong bacteria staying there long enough, and you've got them going through the intestinal wall, which they will, once the lining of the gut is sort of locked open, you have to think that the gut lining is extremely intelligent and very flexible and moving.
We arranged with the colon therapist that every time I would go into an anaphylactic reaction or saw it coming on or felt it, that they would rush me to colon hydrotherapy. The moment she put me on the machine and I had the first release of toxic matter, the throat was open, the swelling in the face was down immediately.
All these colon hydrotherapists work in the trenches. They work mostly with really ill people and people who have it's the place of last resort.
A long time ago, even your old timers said it's all in the gut. You know, disease begins in the gut, but we say health begins there as well.
It's an honor for people in South America, in Latin America, in Europe, and in China to ask me to come and teach and to lecture and present my courses for certification. They won't do that here.
Well, we're very arrogant in the U.S. We tend to think that we have a great medical system. It is a great system if you're in a bad car accident, break bones, and you need to be patched back together.
Understand that every other country in the world, to my knowledge, other than the United States, not only endorses but uses colon hydrotherapy as part of their medical protocols.
We start to regain this appreciation for your digestive system, your core, really being at the core of your health issues. We're starting to understand more of the healing. The challenge is that medical physicians today are not really trained that way.
What people forget is that most of our immune system is based in our gut. So if that's the case, then that gut connection through the hepatic portal vein goes right into the liver.
I think breast cancer could very definitely be related to poor bowel hygiene because we know it's called enterohepatic recirculation. You're recirculating estrogen, and if they were meant to go out and you're reabsorbing them, it could cause cancer not only of the breast, but the uterus, the cervix, certainly the ovaries. In men, head, neck, and lung cancer associated with toxic estrogen metabolites.
If you're accumulating a lot of garbage in your intestines, small and large intestine, and therefore in every cell in your body, nothing's going to work right.
Food really impacts the way you think, the way you feel, the way you sleep, your energy, your mood, everything.
Remember, especially when we come to elimination, if the body is not eliminating properly, then the body is hanging on to the toxins, the waste products that it's already identified that it wants out of you.
One of the doctors that I was working with said, next time you have a colon hydrotherapy, have them extract with a hypodermic needle a little bit of the hot fluid. And the doctor told me to buy a little piece of sailcloth for sailboats. So we took the hypodermic needle and we took just a little drop of the fluid that actually came out of my body, put it in the center of the cloth, and it burned a hole through it, all the way to the edges, just like a cigarette burn. If you put a cigarette to fiber, you know how it kind of just spreads? It's exactly what it did.
The body was designed to eliminate toxins either in the urine or to sweat them out, but a tremendous number of toxins leave in the stool.
I could just feel the levels of toxicity that were being removed from my body. I started sweating on the table. I felt like I was gonna, get sick on the poor colon hydrotherapist.
When you realize that you can reduce that toxic burden in the liver, and all of a sudden all the symptoms start going away, people think you can part water.
I saw people's lives change. I worked with doctors who were treating cancer. I did all their protocols for nutrition and colon hydrotherapy, and I saw amazing things happen to people.
There are a lot of medical practitioners, physicians, gastroenterologists, doctors who have just said point blank no. They have said, do not explore colon hydrotherapy. It can ruin your gut flora. It can, make I've heard somebody say it could make your bowels lazy, like you won't have to go to the bathroom and, you get used to just pooping through a tube or that sort of a thing. These people are making comments about things that I don't think that they necessarily understand, nor have they experienced.
I always find it really amusing because people will say, my doctor says I can't do colonics because it washes out all the bacteria in my gut.
Do you get dehydrated? No. Colon hydrotherapy hydrates the body.
Well, what's amusing about that is that the bacteria won't live in a nasty gut. They have to have a clean, healthy environment to survive in.
There isn't any evidence that any colon has ever been punctured. However, there is a lot of evidence that colonoscopies have punctured colons.
This myth that you shouldn't do it at all, or that you can do it with laxatives, or that you can just have a few sessions and I'm done is just a myth. It's a lack of understanding of what's really going on in the body.
If you have the capacity in the body to create a toxic substance, to burn a hole through a piece of sailcloth, what is it doing to the delicate tissues in the entire body?
If your food's not being digested and processed and eliminated, where's it going and what is it doing?
A lot of this is mechanics, and people need to think mechanically.
We have all the right tools, we know what to be doing, but a lot of people just don't want to do it.
Learn to make those changes. Your doctor's not a magician.
If even one of your patients, or if even someone in the media comes in and asks you that question of what do you think about colon hydrotherapy, I think the responsible thing would be to have said, I've sat down with 10, or I've reached out to the board of colon hydrotherapists or their association, and I've sat down and I've listened to them, and here are my concerns.
The International Association of Colon Therapy is geared towards that. So I think they do a dual function. Not only do they help people with their intermittent problems with constipation, but they also educate on fiber, hydration, exercise, sleep, stress reduction.
And if they choose to not see you as a practitioner, also understand that's because there are other practitioners that may have made the decision that under the right circumstances, colon hydrotherapy is perfect and highly effective for their patients.
People need air filters in their house, air filters in their car. They need water filters. And the other thing everybody needs at home is either a Kalima board, which is a type of an enema, or even a home colon hydrotherapy.
Many times I've thought if I could just get a hold of somebody's ear in the White House and say, I know how we can save billions of dollars. Let's keep people healthy. Duh, it doesn't take a rocket scientist.
Natural health is real.
When you see people getting well, that's enough for me. I don't need all the research myself.
When you see for yourself and you work with thousands of people and you see people get better from something, there's no one that could change my mind from that.
If you learn about colon therapy, you will be on the road to beginning to heal your body.